Hi, I'm Guy Powell, and welcome to the next episode of the Backstory on Marketing. If you haven't already done so, please visit ProRelevant.com and sign up for more of these episodes and podcasts. So, the big question today is, what does it take to change the brand in healthcare? No one thinks about the challenges of building a brand in healthcare more than Douwe Bergsma, the CMO of Piedmont Healthcare. He's done it, and he's done it in spades. For me, though, I am the author of the newly released book, The Post-COVID Marketing Machine, Prepare Your Team to Win. And you can find more information on this at marketingmachine.prorelevant.com. So let me tell you a little bit about Douwe Bergsma. Douwe Bergsma joined Piedmont Healthcare as the CMO, Chief Marketing Officer, in February of 2020. He came to Piedmont with more than 27 years of marketing experience with two well-known brands and companies, Georgia Pacific and Procter & Gamble. At Georgia Pacific, Douwe was responsible for accelerating business growth, primarily through brand value, customer experience, and product and marketing innovation. He was its first chief marketing officer and was tasked with bringing a new consumer focus and transformation strategy to that arm of the business. Prior to that, he was at P&G for over 20 years in a variety of profit and loss roles, helping to transform strategy and innovation with customer-first positioning. His most recent role with P&G was as the marketing director of Pringles North America, where he led a turnaround not just for the Pringles brand, but also to help lay the foundation for transforming P&G's marketing model and strategy. Bergsma attended the University of Groningen in the Netherlands, and he and his wife, Carolyn, live north of Atlanta with their rescued, retired, and active horses and other animals. Douwe, welcome, and great to have you here today.
Happy to be here.
Yeah, thank you very much. So tell us about your backstory on how you got into marketing.
Yeah, I was back in college, and I was in business school in Groningen. And as you go through the years, the closer you get to graduating, at one point you have to kind of declare your direction. And I actually chose logistics. So I was doing my internship, which was a 6-month program within a company on a logistic challenge. It was a project for the broadcasting company in the Netherlands, which was at the time the largest broadcasting company and production company in Europe. And they just got privatized from government-owned to privately owned. And one of the challenges they had was logistics. So they hired a consultant, and then the consultant had me as a part of the team as an internship. Loved the project, but I realized that logistics and supply chain and production was not the area I was most passionate about. And so late in my career in college, I switched to marketing, and I asked the same company, said, hey, would you mind I do another internship and another thesis? And they were like, hey, yeah, go ahead. We know you, and you can help us with the marketing and a commercial challenge. So that's what I did. So I wrote 2 theses. One was a logistic thesis, and one was a marketing one. When I graduated, and then after graduation, I got recruited by Procter & Gamble, and the rest is history, as they say.
Yeah, fantastic. Well, the theses must have been really good, because to get and to start with P&G out of college is definitely something that's not that easy to do. So congratulations on that. So you're now at Piedmont Healthcare. Tell us a little bit about that.
Yeah, so after a long period in consumer products, goods, and a variety of roles. Actually, in the 2 decades I was at Procter, about half of that I was on the brand side, running the P&L and the marketing for brands. And about the other half, I was actually in a sales organization. But it was always focused on consumer goods, working with retail and marketing directly to consumers. So I joined Georgia Pacific after that. Was my first chief marketing officer. I was pretty excited. We have a range of brands like Dixie and Brawny and Angel Soft and Quilted Norton and Sparkle and Vanity Fair. And that was very exciting. But at one point, if you've been in CPG for the amount of time that I have been, I was looking for a different challenge and in a different industry. With the assumption, obviously I didn't know for sure, but the assumption that the knowledge and skills and experience I gained over the years in one industry could be of some value in another industry. And as I was looking around, Kevin Brown, the CEO of Piedmont, was looking for a chief marketing officer for Piedmont. He reached out to the Atlanta Chamber of Commerce. They happened to know that I was, quietly looking for another opportunity. So they connected me with Kevin, and Kevin and I struck a conversation. So I always say, the question often is, why did you join healthcare? And my answer is always, I didn't join healthcare, I joined Piedmont. Because I don't know if I would have joined any organization in healthcare, but his vision that he laid out and his ambition, the purpose, that really resonated with me. And I concluded that if that's the vision, to transform healthcare, to make it more modern, forward-thinking, further enhance the experience and the access, if that's truly the vision, I think I can, add value with my experience coming from the CPG industry. So that's how I landed at Piedmont.
Yeah, fantastic. Well, it's definitely a big change. Although I noticed from your bio, and also because we've known each other for quite a while, that one of the big things is focusing all of your activities as a marketer, really an understanding of of what your consumers are doing, how they're making decisions and things like that. And that's one of the things that impressed me with your background.
Yeah, the consumer plays a central role throughout the work, but isn't that what marketing all is about? Is changing consumer perceptions and therefore changing their behaviors, and that is the common thread through a marketing career, regardless of what industry you're in my opinion.
Yeah, absolutely. And you'd be surprised, though, and I'm always surprised. Sometimes you, as a marketer, get kind of stuck in a cubbyhole doing something, and you quite often can lose that focus and really just think about, well, I've got to get this marketing, this media plan out, or I've got to get this campaign done, and then you kind of lose focus as to, wait a minute now, how is this going to affect the consumer behavior that we're really trying to affect?
Yeah, you're right, and I've done that. Rest assured. So, yeah, it's but hopefully not to the extent that it was detrimental to the brand that I was steward of at the time.
Absolutely. So when you think about that, then, tell us some of the differences between building a brand in consumer packaged goods versus building a brand in healthcare.
Yeah, there's a lot of differences. But before I highlight the differences, I also want to make sure that people realize there's also a lot of similarities. The engaging with consumers and marketing and building a brand has a lot of guidelines and principles that are true over time and true across industries. But if you look at the difference between CPG and healthcare, there's quite a few. First and foremost, obviously, the reason why people engage with the industry. In one area it's for consumption, and the other area is either to address a health issue, or like one of the most positive ones is prevent health issues or deliver a baby. Those are the exciting parts. All the way through, transplant a liver or a heart where needed. So that's a very obvious one. Another obvious one is how pricing and funding of the services work. In CPG, you don't have an insurance to cover the cost of, your laundry detergent, where in healthcare, you have a healthcare insurance, typically through your employer or for the government. The pricing, therefore, is set in a different way, less frequent, less variable. So that's another obvious difference. But from a marketing perspective, a few other things that I highlight. Most healthcare brands are a single brand. where most CPG are a house of brands. At Procter & Gamble, at the time I was there, we had over 100 brands across the world. At Georgia Pacific, we had about 8 to 9 brands, depending on the innovation project we work at. Here at Piedmont, there's just one brand, it's Piedmont. Now, within that, you have a whole brand architecture. You have Piedmont Heart, and you have Piedmont Oncology, and you have Piedmont Ortho, et cetera, et cetera. But it all rolls up on the Piedmont. That's one big difference between healthcare and CPG. But it's very similar to like how car companies have a single brand and then the sub brands underneath it. Another difference, obviously, is it's very service oriented, therefore very labor intense, very location important, and you own the whole chain from, we own the buildings or lease them, the staff, the doctors, the devices, etc. Whereas CPG, you sell to a retailer who then sells it to consumers. So that's another big difference. Culturally, a big difference is that marketing in CPG, I always say, plays a leading role, as in it's the number 1, 2, sometimes 3 priority combined with, sales and R&D. If you look at P&G, it was marketing and R&D. If you look at Georgia Pacific, it was sales, production, and marketing. In healthcare, marketing does not rank that high on the ladder of priorities. If you look at the spending levels, you look at the staffing, the sourcing, the level of advancement and innovation. It's not the industry that people turn to be inspired and to learn about marketing and brand building. You look at Cannes Lions or the Marketing Masters or the AMA events. You rarely see healthcare marketers talk about their branding accomplishments unless you are in a healthcare environment. So there's a ton of healthcare, conferences and podcasts and stuff, and obviously that's all about healthcare. But once you go outside and it's multi-industry, you have the car companies and the QSRs and the CPGs and the car and the banks, but you rarely see healthcare CMOs on stage at Cannes Lions, for example. And that's for a reason, because marketing is not that big of a focus area for most.
Yeah, that makes a lot of sense. And I think your point too about marketing leading the consumer packaged good decision as opposed to healthcare being a little bit different. You've got on the consumer packaged goods, I would consider that really a relatively low consideration kind of a purchase, whereas healthcare is a very high consideration purchase. And then your relationship with your healthcare professional has got to be very strong in exactly what and how you're going to do next to either, improve your health or, like you said, have a baby or, check up on your health or whatever.
Yeah. And it's interesting. Like if you look at it, I think in Procter & Gamble's history, there was only one CEO, maybe 2, that did not come from the marketing function. I think if you look at all healthcare systems around the world, through the 200-300-year history, there might be 2 CEOs out there that came from the marketing function. So it's like one company you cannot imagine not being a marketer from a function background. And in healthcare, that doesn't happen. Now, it's true for other industries like banks and, insurance and probably retail. But healthcare marketing has a lot of upside, in my opinion, but has not earned that seat at the table to the extent it was they had the seat in CPG.
Well, but with you coming out of CPG and obviously bringing that wealth and richness of knowledge in marketing, then Piedmont must have seen that marketing and building the brand was important. What were some of the, if you can, what would be some of the things that drove that impetus to say, hey, we need somebody from the outside that really understands brand building and putting the customer first, so to speak?
Yeah, no, I had those conversations with Kevin Brown, our CEO, during the interview process before I joined. And one of the questions is like, I have no background. My mom was a nurse in her younger years, and my dad was on the healthcare side when he was in the military. But other than that, I have no experience or background in healthcare myself. And his answer was, that's why I'm very interested in you joining Piedmont, because he wanted to bring the outside in. And he wanted to bring expertise, skills, and knowledge from a industry where marketing was very well established into healthcare as part of his transformation vision. So it was by design, and hopefully I live up to the expectations. Time will tell, but that was one of the key drivers to recruit me here.
Yeah, absolutely. Well, and I heard you speak at the recent AMA event, and it sounds like you've been successful. How have you been measuring your success and been building on that success?
Yeah, well, I'll let the conclusion of being successful to others. But we can't complain about the progress that we as a brand growth team have experienced in close partnership with our colleagues across the different departments. There's a few things that we've started to do different. Not all of them worked right away, and some of them actually never worked, but a lot of things did work. The first thing we actually did is assessing our landscape and saying, okay, what is the purpose of the system? What are the objectives? What is the strategic framework? What is the vision? And how can we align our efforts to that strategic framework, to that purpose, and to that vision? And there we realized that in some areas, things were really well done, already in place, and in some areas, there were some gaps. One of the gaps that we noticed was that the measurements and the metrics. At the time, there was no clarity and consistency on several metrics, and we put those in place so that we were clear, like, okay, this is our ambition. These are the goals, and this is how we measure it. So we start to measure our brand health more consistent and start acting against it. We continue to measure our what we call our brand activation and our short-term conversion efforts, which were already in place. So, we call office visits and patient count, operating margin. And the one thing that was also in place at the time is measuring the adoption of our digital tools like online bookings, online check-in, adoption of the Piedmont MyChart app. But we started there. Let's get clarity on the metrics and the KPIs that we are responsible and accountable for. That was step number one. Step number two is then, okay, how are we going to get there? And what we've developed and introduced is a more holistic approach where we look at 6 elements of marketing. First, assess the landscape. Who's the competition? How are we performing? What are the ambitions of the organization as a whole? The second, obviously, is about targeting and understanding who are the consumers and the patients we're after. From a Piedmont level, which is one thing, but all the way down to a physician and a practice. You can only imagine that if we want to grow our labor and delivery volume, that target is very different from if we want to, grow our heart transplant. So we stepped that up and further expanded that. We created an insights and analytics department, promoted some folks there. We have a great leader there, and literally started to develop a data-driven, science-based marketing and brand building approach. The third thing we did is continue to develop the brand positioning. Like what does Piedmont stand for in the hearts and minds of the consumers in the state of Georgia? Atlanta is one thing, but we moved into Augusta. We are recent in Athens and Columbus. We're moving into Macon. So what is it we stand for, and what is our brand positioning? So we did all of that homework. Some of that was already in progress. Some of that was completely in place, and some of that needed some attention. And then we translated it into 3 efforts. One was the brand building, making sure we drive our long-term brand health. Second was what we call brand activation, which is all about translating the brand into into sales, into patients, into consumers. It's all about conversion. An area that you're very familiar with for your company. And then the third one is drive what we call brand orchestration, which is all about optimizing the consumer experience. So the first one is more about awareness and favorability. The second one is more about conversion, office visits in our case, and operating margin. And the third area is more about the adoption of our digital tools and the Net Promoter Score. And if you do those 6 things, things should start going your way, and they actually did. So we were very pleased with the results that we have in our first 2 years. And keep in mind, we did all of that while dealing with COVID. So it's, I joined 5 weeks before we had our first COVID patient. So I let all these ambitions that were like very high on the priority list the first 5 weeks. And then after that was all COVID. But in the background, we managed to do everything I just described.
Yeah, that's pretty good multitasking. And that as a healthcare provider, when COVID struck, man, oh man, that, through more than any other business, probably, healthcare, and into some crazy times. So good for you.
Yeah,
and,
I always joked, the world was on fire and I just joined the fire department. And it was talking about difference between CPG and healthcare. My colleagues at Georgia Pacific were like, oh, we're out of toilet paper and we're so much demand and the whole country is looking for toilet paper. Like, I would sign on to your problem in a heartbeat, because being short on toilet paper is really different than being short on vending machines and masks and nurses. And like, in your case, it's very inconvenient. In our case, lives are at stake.
Right.
So that was a very, very big difference that became very clear very early on in my career in healthcare.
Yeah, absolutely. What a way to start. Start your career in healthcare is right away with COVID. Wow. The other thing too that comes to mind when I think about CPG as a product-based, a well-defined product versus a service-based business where you have a lot of different touch points. And so does that also mean that your marketing stakeholders are not just patients and new patients, but it's also your internal service providers and healthcare providers that are on your team?
Yeah, and like other service industries, a lot of the things you do, it's important to get your employees and your staff aligned to your efforts, right? You can't say, hey, we stand for this, and your employees like, oh, I don't know what you're talking about. That's not who we are. So there are several constituents. One is obviously the consumer/patient. The second, obviously, are employees. Keep in mind, with 37,000 employees, we are the largest or one of the largest employers in the state of Georgia. Number 3 is the physicians. Now, many of the physicians are employees, but there's also a large part of physicians that are affiliated to Piedmont, use the Piedmont brand. They're part of the Piedmont brand, but not part of the Piedmont organization. So those are, so physicians actually split in two, employed and non-employed. Then you obviously have your employees, your physicians, your consumers, and then you have other stakeholders, whether it's the local community leaders, whether it's employers that pay for the services of their employees. It's obviously the payers or the insurers. It's the local politicians and administrators, because the role of a hospital, the role of a healthcare system, especially in smaller communities, is immense. A good hospital could make or break the growth of a community. Typically, we're the number 1 or number 2 employer of that county or that city or that community. We're typically the organization that has the vendors and the suppliers depend on. So the economic impact of a healthcare system in any community is pretty large. The benefits to the community is obviously, almost indispensable because you provide the healthcare. So those are a few differences. So you have a lot of constituents, but for us and for my team, it's consumers and patients first. And second one is the physicians, because I also oversee our sales department. We call that physician outreach, where we focus on physicians referring their patients to our specialty care physicians if and when their patients need specialty care.
Interesting. Yeah, interesting. I hadn't thought about the referral side of it from a sales perspective. Yeah, very, very interesting.
Yeah, there's a big B2B part to this. I often talk about the BDC, but there's a whole B2B arm to this work as well.
Yeah, and it's that complexity that actually makes marketing fun, because it's, I mean, not that working for P&G wouldn't be fun, but having the B2C and then the B2B, and then also the magnitude of the different number of stakeholders and stuff like that really makes a big difference, and it offers a lot of interesting challenges.
Yeah, no, and add to that, thanks for mentioning that. In CPG, it's not common to combine communication under their CMO and the marketers. Some actually do, but when I got to Piedmont, and I think it's more common in healthcare, I also oversee internal and external communication. And during COVID, that's actually where most of my time went. You had to communicate with your employees and your physicians nonstop about the latest and information on COVID, visitor policies, do we have masking or not, social distancing, what is the CDC saying on Monday, Tuesday, and Wednesday? And then external communications has a massive role. Compared to what I've been used to in CPG, if you look at your impressions, as a standardized measurement unit, the impressions that we generate for our PR and earned media are so much larger than any of our marketing and paid media. I could air nonstop on TV at every station in Georgia. The impressions that I would get for that are still not close to what I'm getting for the PR efforts. So that was another big difference, because people want to hear from, your doctors, or they want to hear about the new wing in the hospital, or the new tower, or the expansion into Augusta. I remember working at some of the toilet paper brands at Georgia Pacific, and getting PR attention to toilet paper before COVID was a pretty interesting challenge. Like, what do you talk about? What do you write about? And we would celebrate if we got earned media, maybe like a few times a year. Yeah. At Piedmont, we're in the media across Georgia several times a day. And during COVID, we've been on international networks, national networks a lot, and obviously nonstop on regional, statewide or city-specific networks. So that's a whole different dimension, making it all very interesting.
Yeah, absolutely. Yeah, no, absolutely. And I could imagine that really gives you, domain expertise, and being then looked upon as being the domain experts in this case on COVID, or now on things like doing transplants here in Georgia, or whatever it happens to be. So yeah, I can imagine that'd be a very big piece, especially too when you have such a high consideration decision that has to be made about, where do I go for my health, and can I trust them, and do they really know something better or worse, or not from some competitive alternatives. Yeah. So now one thing I did want to go back, which I thought was also kind of fascinating. Normally I'm like kind of an old 4 Ps kind of guy: product, price, place, promotion. And in CPG, of course, price and relative price makes a difference, and what the promoted price is and things like that. But here in healthcare, the price almost is unimportant, or is that not correct? Because the payer is actually what you're paying in your insurance. There might be a deductible involved, but technically the insurance provider is the one that's doing the paying. And so the price is maybe not as much as, or not as important as it might otherwise be in consumer packaged goods. Is that true, or is that not true?
It depends. It's more true. than it was in CPG. If you're insured through your employer and you have a low deductible, pricing is probably less of a variable when you make your choice than when you're uninsured or where you have a high deductible. So where in CPG pricing was, the number 1, 2, or 3 attribute that people looked at, or they would state it's like not important until buy one get one free in the store, and all of a sudden became the driver for impulse buy. You don't have that in healthcare. Like we don't have flu shot coupons and get your COVID and your flu get your COVID test and get the flu shots for free. So that's like I made jokes when I got here. Like, where are our coupons? Like. It worked really well in paper plates for Dixie. So it's a different variable. It's not unimportant, but it's not as prevalent as it would be in other industries because of the insurance. But it also depends on how you are insured and what kind of insurance you have.
Yeah, I don't think you could lead a marketing campaign with something like, get a heart transplant and we'll throw in a liver for free or something like that.
No, we don't have that. But, who knows?
Yeah, the future is very long and wide open for us. So now you've built the brand, you've done a lot, and you've definitely got this train now in motion, and things are flowing pretty well. How have your competitors responded?
It's very hard to say if they have responded and how they responded. Georgia is blessed with great providers. If you look at some of the other healthcare systems, I don't think there's a bad one. I tend to believe that Piedmont is the best, but I'm kind of biased. But consumers and patients in Georgia, especially if you're closer to the larger cities, have access to great options. In Atlanta, you got more options than in other areas, but it's the state is blessed with good competitors. The quality across the systems, I think, is the one that is very hard to compete on. First of all, everybody has good quality. Most of them have good safety. Some a little more than others. Piedmont, is the safest and has the most quality awards. But it's very hard to measure for a consumer to say, hey, how do you know that actually I'm with the best? So for healthcare systems, it becomes important that outside of quality, you also compete on, or you offer services in the other areas. Experience being one of them. It's one thing to be among the best in healthcare, have the best doctors, the best devices, the best buildings. It's a whole other thing to navigate that. And so Piedmont competes mostly on access. With 1,400 locations across the state of Georgia, 80% of Georgia residents live within an hour of a Piedmont facility. No other system has that. Like all the other large systems are pretty Atlanta focused or very regional. We are also compete on integration. We have services, from urgent care, quick care, primary care, all the way to behavioral health. Almost no other system has that, where you can get almost all your healthcare needs. I did ask if we were getting into veterinarian services or dental services, and I don't think we are, but you get the point. And then we also want to make it sure, on top of quality, access, and integration, we also want to make sure that it is a modern, forward-thinking, easy experience to navigate all of that. And that's where healthcare is very different from many other industries. I always joke it's easier to book a hotel in the city of Melbourne, Australia, than it sometimes is to make an appointment with your own primary care physician down the road. And that's what where Piedmont wants to transform healthcare and change that. That's why we always say real change lives here, because that's the area where we say we're not there yet, but we want to be closer to those other industries like airlines, like hospitality, when it comes to finding and booking a doctor online, checking in before you walk in and have all your information conveniently in one place. From a competitive perspective, we don't see us following us in all those areas. We're the only one that cover 80% of Georgia. We're the only one that have this level of integration. We're the only ones that are this far ahead on a easy navigating and simple engagement with the system, even though we're still not where we want to be. But we do see them following. We do see that other healthcare systems are, engaging with vendors that we've engaged for many, many years. We see them, if you go to their website, pushing online bookings and understanding and directory listings and search optimization. But, you also see a lot of healthcare providers investing a lot in billboards and local printed paper and making appointments through the phone. And so I would say the level of development from the services that Piedmont offers and how we market it, I would say is among the top healthcare systems in the nation. It's not as far developed as I wish it was compared to other industries. But you also have to realize that we work in an industry where, in some areas, some healthcare systems still have marketing approaches in place that are not too different from what we did in the 80s and the 90s. I didn't expect that range of difference within one industry. At CPG, there's a difference, but it's relatively narrow. In healthcare, it's 2023 marketing all the way back to 1985 marketing. And I'm sure I can find that going, to an individual independent practice, or I can go to a healthcare system. And the reason I'm comfortable saying that, when I joined, we had 11 hospitals. Today we have 22, so we acquired quite a few, and I could see what others were doing because they joined the system, and we get like, well, what have you done for the last 200 years? And where are you at today? And it was a wide range of experiences. Sometimes they were ahead of what we did, and sometimes there was a big gap, and we were trying to catch them up.
Yeah, it's kind of interesting too. One of the things with a service-based business is you really don't know how good the service or the product, so to speak, that you're receiving is until you get it. And as a patient, it's not like I can go try, this doctor for this and that doctor for the same thing and say, okay, I like this one versus that one. In CPG, I can buy Unilever, I can buy P&G, I can buy, Georgia Pacific, and I can try all the brands that are there and say, yep, I like this one better because. But in this kind of a case, you just don't have anything to really compare against, and it lacks a lot of transparency for the patients. And I could then see where building the brand would be a big piece of that decision.
Yeah, and when people are choosing their healthcare provider, whether it's a primary care physician or a specialist, a lot of variables play into it. The number one is always, do they accept my insurance? So check, that's a yes or no answer, right? Number two is typically, are they close to home, and do they have availability in the near future? So those three, insurance, distance, availability, those three play a big role. But even if you narrow it, if you look at those, you still have multiple choices. And then reputation of the system as well as the individual physician comes into play a lot. And then, and that reputation is influenced by a lot of things, quality and service and bedside manners and compassion is one part. But a big part of that is also the experience. Like, how easy is it for me to find an appointment, research the doctor online, get his bio, have a video? Can I book an appointment either easy for the services online or through the phone? And as I engage with the healthcare system, is it easy to change my appointment, get in, get out, payment, is it clear to understand? All of that plays into it. Now, keep in mind, I'm always made a joke when I'm speaking in public. The average marriage in the United States lasts about 6 years. Not a good number, but you're with your spouse on average 6 years. Some of the data suggests that if you start a relationship with your physician, it lasts about 9 years. So think about that. Your relationship with your physician is longer than with your spouse on average. So you might want to, make sure you get the right one. Very different in CPG, where people standard buy multiple brands in the same category a year, and loyalty is not that high. You might have a relationship with the brand for a long time, but you typically also have other brands during that same time. Not so much in healthcare. You don't have 2 to 3 different oncologists. You don't have multiple primary care physicians. A little bit different in quick care and urgent care, where people have less loyalty to the physician and more to the facility or to the location. That's happening more in younger consumer segments. But in general, it's a long-term choice, and therefore, the credibility of the brand and the reputation of the individual go hand in hand.
Yeah, very interesting, and I like your analogy of of marriage and your marriage to your healthcare provider. That is very interesting. Yeah. And 50% longer. That's a big difference.
Yeah, it is. It is. Now, the intensity is less, and the frequency and interaction is less. But still, I was shocked when I was looking up those numbers. Like, I wonder how long people stay with a physician. Like, 9 years, and then like, how long are people married actually? And then I looked it up. Like, oh wow, and it gets worse when it's your second and your third marriage. But don't get me started on that.
Yeah. Well, let me change the topic just a tad. What would be your advice for a young marketer that wanted to choose to get into healthcare marketing or into CPG or maybe even something else? What would be your advice to a young marketer?
So there's a few things, and I think you and I talked about it. I teach a week-long class in Cannes during the summer at the Cannes Lions, and they're all like 25 to 31 years old, kind of a group. So they're typically in the second, third job, and then I do guest lectures at Georgia State and NYU. And there's a few answers to that question. The first thing is, for any young marketer or anybody that is starting a career in any field, you need to decide to what extent you want to climb, camp, or quit, and that's an active choice. And everybody in the world at this stage in the career commits to climbing, but a lot of people during the process end up camping without realizing that. But they still believe that they need to be rewarded. They need to have the benefits of a climber. And so my first recommendation to everybody is decide what you want to do. If you want to climb, do everything that's needed to climb. It's hard. There's a lot of barriers. You need to make sure you surround yourself with the right people. Find the right mentors, the right colleagues, the right employer, et cetera, et cetera. If you're camping, that's fine too, but don't expect the same returns as the climbers do. You can't sit there and go through the motion day in, day out, and it's just a job, and I'm working here because I need funding for my real passion, which is outside of work, and that's perfectly fine. But don't expect to be the first one to get promoted or to get the salary increase or to get the resources or get the funding. And a lot of people mistake for, hey, if I'm camping here, I do want all the benefits of a climber. It doesn't work like that, in my opinion and in my experience. The second recommendation I always have, and it's maybe a bit of a cliche, and a lot of people have heard it before, it's make sure that whatever you choose, that first and foremost, it's in line with your values. Whatever those values and beliefs are. As you progress through your career, the values and beliefs of your employer and your colleagues becomes more and more important. Now, out of personal preference and personal choice, there's several industries I chose not to work in. I don't want, I'm a vegetarian, so therefore I prefer not to work in the meat industry. Well, meat industry excludes QSR, excludes, a lot of others that you don't think of, but, some great brands on this planet evolve around selling hamburgers and chicken sandwiches. I chose not to work in alcohol or cigarettes or gambling. So there's a few areas where I say, hey, I don't do that. Now, if that's because it's not aligned with my personal values and beliefs, and I feel good about that, and therefore I accept the consequences of these choices. The second thing I would tell folks, once you figure out what your values and beliefs are, and by saying that, it does help me because a lot of people are aligned to the purpose and the reason for being of healthcare systems. We get fantastic talent where I know, like, wow, you can make more money, have cooler jobs by not coming to Piedmont. And yet you're here and they're like, yeah, that was great, but I really don't want to be doing X, Y, Z. I really want to help the people that save lives. And the second is value, is what your work you're doing is valued. And that's very easy to figure out because, if you're valued, people have jobs and paying jobs and benefits for you. The third area is obviously do something that you're talented in. Good to Great would say, make sure you're the best in the world at it. But if you're that early in your career, it's very hard to figure out what your superpower is. And the last one, and I know there's a lot of disagreement and confusion on that, but do something that you are passionate about. And that's also the hardest for people early in their career to figure out, am I really passionate about marketing? And if marketing, what part of marketing? You and I are both marketers, but we work in very different areas of the marketing, universe.
Right.
Are you going to be more on the creative side, working in an agency? Are you going to be more on the analytics side, working in insights and analytics? Even within my team, you see the extremes. My insights folks are marketers, and my PR folks, I see them as marketers and brand growth. But the former journalist that writes the internal newsletter has very different background and a very different, growth aspirations than my analytics leader or than my physician outreach leader. So even within marketing, figure out what your passion is. But having said that, don't be afraid to test out different things and be open-minded. Say, hey, if this is what I really like to do, but maybe for the next 2 years, I'm going to try this, and maybe I like it. And if I don't, you get back on the journey that you were before.
Yeah, that's one of the things I like about what P&G and some of the other larger marketing organizations do, is you get to try things as you move around the organization and purposefully get a rounded background, but also to find out what you might like and what you don't like.
Yeah, and the one thing I would add to that, I was at Procter for 19 years for that reason. Every time I thought, okay, what's next? They were willing and able to give me a challenge that, thrilled me. Like, oh, wow, I'm going to the US. Oh, wow, they're asking me to set up a whole new industry, which later came to know as shopper marketing. If I look back those 19 years and, the current generation, something looked like, you were one employer for that long? Wow, and I was like, yeah. But it was many different roles within the same organization. At Georgia Pacific, I was one title, one role for 9 years. But the reason I was there for 9 years, within that CMO role, there were so many different aspects that made the jobs interesting. The digital transformation, e-commerce, retailer as media, building in-house agencies, building an in-house media agency, building an in-house design shop. There were a lot of things we did in those 9 years that I would never thought when I got the job, back in 2011, like, oh, this is the CMO job, this is how defined, but it changed over all those years. So for any young marketer, I would say variation comes through different jobs, for sure, but it also can come within the job. But raise your hand and, ask for the stuff. Some of the biggest challenges you have as a supervisor, as a leader, is not knowing what your people want or what their interested are. they sometimes are clear, like, hey, I want a better title. I'm a brand manager. I want to be a senior brand manager. So that's, or I make $100. I want to make $120. I got that. But what is it you want to do? What is your day-to-day life going to be? And sometimes I ask folks, write your own job description. If you could, within our organization, do anything, what would your job look like? Just write it down. And a lot of people are not clear in articulating that. They're often focused on compensation and title, which I understand, but you should be more focused on the day-to-day activities and the skills that you are developing and the experience that you will have.
Yeah, exactly. And actually that ends up being a very good way to give a review, is to point the review in terms of, well, what are the skills that, and what are the experiences that you need to have to be able to get to the level that the level or the position or the opportunity that you'd like to have. Makes a lot of sense. And I really appreciate that. And I think, young marketers, because they're, coming out of college or have had maybe one or two jobs, but, having that an understanding of how to really make a decision as to what their next couple of years or the next 10 years are going to be is really critical. Thank you so much for that. Before we close, anything else you'd like to mention?
Yeah, one of the things that I didn't realize early on and became more and more important as I progressed, and also share with a lot of folks, started earlier than I did, is the networking. I know you're great at it. You run into you at many events, and you're an author. You play a leading role at the American Marketing Association, and so that's how we met, right? But the role of networking is really important for multiple reasons. One is gain knowledge. Through the years, I gained the most knowledge and had the best insights through the conversations and interactions I had with others. Sometimes it was a peer, sometimes it was a vendor, sometimes it was a direct report or a former direct report. So it keeps your eyes open to what's out there. The second thing of the networking is kind of knowing what's out there from a working perspective and experience and skills. So nothing is more informative to talk to somebody and say, hey, what is it you do? Like you and I just had this conversation earlier. And what makes you tick, and why, isn't that exciting, or why is it exciting? And how do you got there? And that can help you inform, oh, maybe that's some area I need to go to. And then the third area of network, which is the one everybody knows, is whenever you need a job, your network is just one to go to. But networking is so much more than that job opportunity creation. It's also gaining knowledge and gaining perspectives and see alternative routes. And it took me a while. I actually started my networking efforts on a large scale after I left P&G. When I was at Georgia Pacific, and realized, wow, all of a sudden everybody's looking at me for the best-in-class marketing knowledge. And I got a lot after, my time at P&G, but it's going to be outdated soon. And where do I go? And that's when I started my networking journey, to realize that I could have started it way earlier in my career. Yeah, other than the networking within your company, that's a given, right? But it's the networking outside of your safe environment that I'm referring to.
Yeah, and same here, guilty as charged. When I first got out of college, it was 5 or 10 years before I realized how important networking was. And you just don't seem to have I remember back, it just didn't seem like I had the time to be able to spend going to networking events. And now, I'd rather be networking and talking to people and talking to learn and getting to know them, but also to learn new things. And if I can pick up one new nugget at any networking event, then I feel that that's a success.
Yeah, I know that's the case for you, and it makes a lot of sense. And you can call us old school, but when we say networking, we don't mean social networking and having X followers and friends, or different platforms. It's literally having a person a personal connection with somebody. It's about cultivating warm relationships with people inside and outside of your safe environment.
Absolutely. Absolutely. Well, Douwe, thank you so much. I'm so glad to have you today and talk with you today and learn a little bit, a lot about Piedmont and then healthcare and then your background and everything. Really appreciate that. Thank you so much.
Thanks for having me, and thanks for highlighting Piedmont.
Absolutely. And so for the audience, please stay tuned for many other videos in this series of the backstory on marketing. Please visit marketingmachine.prorelevant.com, and you can download the first chapter of my book and other valuable excerpts. And also, don't forget to sign up for more episodes in the podcast series that goes with it. And if you like this podcast, please rate it with 5 stars. Douwe, thank you so much.
Thank you. And if you need a physician, go to piedmont.org.
I will.